Thank you very much. Good morning, everyone, and welcome. It is with great pleasure that I bring to you the greetings of the institution that is hosting this conference, the Cancer Institute of Milan. I have been asked to greet you on behalf of Drs. Colombo and Dr. Corvo, the General Director. You are here in an institute which celebrated 80 years since it started its activity last year. And I am sure that you will all agree that most of the Italian oncological studies started from here. And for some sectors, not only the Italian oncology, but more broader oncology. The subject of this conference is very interesting. Dr. Lanfranchi mentioned it in his opening words. If you allow me a couple of minutes, I will try to offer a few comments on oxidative stress and inflammation in oncology. I deem it dutiful, however, to comment the context in which this conference is taking place. To some extent, as Alberto has already said, we have a large group of complementary medicine, which is in the oncological field, of course. This is a very delicate field of activity because we know how these topics are and may potentially be instrumentalized somewhat. That's to be frank about things. We are convinced, nonetheless, that opening up to these subjects corresponds to a certain type of attitude and behavior that our institute has always had. Our basic idea is to consider reality and all the factors that constitute it without placing any boundaries to knowledge. Because if you hide behind some sort of rationale, you become sort of self-referential, and that is no good. So having said this, and having said how open-minded we all are here for this type of complementarity, we shall never accept the concept of alternative medicine in oncology, because that has led to a certain amount of damage in patients. But as far as complementarity is concerned, we are very, very open-minded. Of course, you need to be careful. I was reading a few sentences for the promotion of a commercial product, and sometimes we have different sorts of things, and we speak about evidence-based medicine or holistic and a scientific type of approaches. Now, science is one and only. And the method with which we approach the idea of complementarity is a totally scientific method, and we cannot waver from this. So, of course, we're very open-minded, but we allow for no discounts. We need to have experimentation which is statistically sustainable. There must be a placebo to compare with, so that the best possible outcome is allowed. A double-blind system must be adopted, and there has to be a measurable outcome, independently of what might be the sensation or feeling of the patient. Let me give you an example, because I think that this is quite suitable here. Dr. Berino was mentioned. Now, Dr. Berino works in a field that is very difficult to deal with, which is the influence of diet, also in terms of response to chemotherapy, apart from the idea of cancer prevention. Now, the quality jump that Berino's approach has made has involved going from a 10-rule system, which is based on common sense, and which was accepted very broadly, to an approach which is totally scientific, because Dr. Berino's parameters are parameters that measure the hormone levels, the growth factor levels, and with a study that has the four requisites that I was mentioning earlier on. He actually proved his theses. This is what I really wanted to say about these complementary approaches, as I have called them. As far as the subject matter of the conference, well, this is perfectly in line both with the most advanced concepts of what our vision of cancer is and the novelties that have emerged recently. And indeed, we know that the model that we deem is the most valid one, but we're ready to change it if experimentally it's proved differently. Cancer cell degeneration of the cell genes, and therefore we have to work for the non-alteration of these genes. Most of the causes are exogenous, but there are many causes. The exogenous ones are due to substances that can alter the DNA, cancerogenic products. These are products that to which we are exposed on a daily basis, pollution, cigarette smoke, and a number of other things that introduce these substances into the human body. It also is due to exposure to radiating effects, but also for spontaneous regions. Every time DNA repeats itself, it's like the draft of a book that is rewritten by a typographer, and these letters can be changed from one time to another. A recent acquisition, which is quite interesting, is how, in the end, all of these different causes interact directly with the DNA. And this is something that has absolutely to do with oxidative stress. Because in the end, what happens is that the double coil of DNA ruptures and when there is oxidative stress. And this is the first element that's contained in the subject matter of our conference here today. Nonetheless, a cell does not transform itself and turns into cancer in a void, but rather in an environment that we will call the cellular microenvironment. The idea comes from the past, but only a few years ago, the concept that once a cell transforms because its DNA has been damaged, in order to grow and spread, it needs to have a particular type of environment. And this is essentially supplied by the inflammatory environment. There are, of course, exceptions such as HPI. However, 30 to 40% of cancers, the IARC of Lyon in France, which has investigated cancerogenic substances and so on, has recently estimated what the percentage of cancers due to infective reasons, bacteria, viruses, and so on. And almost always, these causes are connected to the setting up of a microenvironment containing inflammatory connected elements. So there we have the two ideas, the exogenous and the endogenous system that can lead to cancer. Studies have been carried out on this, and I would like to quote our institute, Dr. Alberto Mantovani, who is here and who will be speaking later on, presented the first experimental outcome of the thyroid cancer that an oncogene activates an inflammatory program, and that is the reason why the tumor will then be allowed to progress. Therefore, all approaches, apart from the classic ones that we are well acquainted with, that must be scientifically demonstrated that you can reduce oxidative stress and reduce inflammatory phenomena based essentially on the rationale that I have just described to you. I wish you very much success for your work, and I hope that you will leave the hall this evening with renewed enthusiasm, better knowledge of the problems. Unfortunately, I will not be able to be here with you. I know it's Saturday, but I have institutional commitments. This morning I won't be able to be here, but this afternoon I will come back and we would like to confirm the presence of our Nobel laureate, Dr. Luc Montagnier, who most certainly knows a lot about cancer, and we're very happy that he will be here with us. Thank you very much.